The following segment is sponsored by the Utah Fertility Center. Infertility is a tough journey. You guys, I know personally, but there are ways to improve your chances. Dr. Sean Gertschiff is here from the Utah Fertility Center to share expert advice on optimizing fertility and where you can find the support that you need. Welcome to the show, Dr. Gertschiff.
Thank you so much for having me,
It's
Kami.
so good to see you. This is such an important topic. It is affecting millions of families out there, and thanks to you, they have somewhere to turn. So the first question is, what are some natural ways that people can kind of take that first step to help with their fertility journey?
Yeah, so we would definitely recommend eating healthy, exercising regularly, having frequent intercourse, and trying for at least 6 months, especially if you're older than 35. Like if you're trying for 6 months and you're struggling, please come in quickly and get help. If you're younger, you have a little bit more time, you can take up to a year. If you know that you have issues in your family, or if you have some sort of health condition like endometriosis or polycystic ovarian syndrome, then come and see us sooner, because we know those things have a negative effect on fertility.
Well, I think along my personal fertility journey, I learned, like you said, eating healthy, that affects everything. And then you guys really guide us, and every step is so important. So first, trying naturally. So what would be the next step? How would you kind of optimize fertility if you really are needing help through you guys?
Yeah, so the first thing obviously to do is just pick up the phone or reach out, and sometimes that can be really hard, right? Admitting that you need help can be like a really tough part of the journey. So we're there to help figure out what's going on, fix it, right? Or if there's nothing that we can find, or if we can't fix it, there's still lots of options available for treatment, and kind of walking you through that process. So the first part would just be picking up the phone, and then we would start kind of a range of diagnostic testing, trying to figure out what the problem is, depending on what we find, starting treatment.
Well, and how common is this? It seems like it is affecting so many families in different ways. The man, the woman, what do you really see?
Yeah, absolutely. So it's interesting because a lot of people do feel like it's really common, and it affects 1 in 8 to 10 families in the US. But we don't know if it's actually getting more common or if people are just more willing to talk about it, and there's so many more options available. Like when I was a kid, there just weren't that many options, and now we have lots of options that are very effective, and so we can help a lot more people.
Well, I think by you coming in, it's really showing people, if you guys are watching, picking up the phone, and it's not just you, they can help. So what are the initial steps through the fertility? Kind of walk me through that really fast.
Yeah, so typically an initial consultation, and we'd start evaluation, and as you said, so sometimes it can affect the man, sometimes it can affect the woman, sometimes it's a combination of factors. So basic testing would usually involve checking a man's semen, checking a woman's ovulation, her kind of reproductive anatomy, so some blood work, imaging of the uterus and the tubes, and that's usually kind of the first step. And then meeting and talking through all of that and figuring out, do we have a specific issue that we can address? Sometimes it's medication, sometimes it's surgery, sometimes it's just changing certain things about lifestyle. Sometimes we don't get an answer, and about 10% of couples have what we call unexplained infertility, which doesn't mean there's not a problem, it just means we're not smart enough to figure it out. But fortunately, there are effective treatment options in those cases as well.
Well, what I've learned is that it's a very intricate system, and there are so many moving parts, and part of it is timing, and you guys are there along the way to really help guide everybody. Where can everyone go for more information? How can they call you? How can they find you?
Yeah, so utahfertility.com. There's also great information from the American Society for Reproductive Medicine at reproductivefacts.org. Yeah, but please reach out, because we're here to help.
Well, you are an incredible doctor. Thank you for doing what you're doing for so many families like myself. We wouldn't be able to do it without you. Thank you so much, Dr. Gertschiff.
Thank you. Thanks for having me.